I have Dr. Donald Piland.
Thank you for your time, Mr. Mayor. My name is Dr. Donald Piland. I've been a practicing internal medicine physician in Poplar Bluff for 37 years. I'm on the board of directors at Poplar Bluff Regional Medical Center, and I'm a fellow in the American College of Physicians. All of which to say is I've been around for a way long time and have seen a lot of viral disease come and go. It's no secret that the United States and our area in particular is under siege by this terrible virus, COVID-19. We have recently been recognized in Southeast Missouri as having one of the most rapid rates of per capita increase in hospitalizations, and that includes the entire country. Our COVID unit at Poplar Bluff Regional has been full for the last 3 months, and we've been transferring patients out of our emergency room simply because we don't always have room in our COVID unit. And those patients may go to St. Louis or to Cape Girardeau, but oftentimes they end up in small towns such as Harrisonville, Arkansas, or maybe up in Belleville, Illinois, or even as far west as Tulsa, Oklahoma. We lost nursing and respiratory therapy staff to desperate communities like Houston, Texas, where they can afford to pay as much as $175 per hour, while those employees will encounter the same personal COVID risk in those high-paying communities. That makes it very difficult for us to compete with that price, and it makes it difficult for us to staff our area. We've seen an increase in COVID-related admissions, COVID-related deaths, COVID-related outpatient visits, and unfortunately, COVID-related sadness. As a population, we've been dazed and confused by the mixed messaging out of Washington. All the while, our elderly and infirm have been devastated by a brand new virus that has largely been passed on unknowingly by younger citizens who have been barely affected. We've seen a husband and wife die within a week of each other due to COVID. We've seen a 26-year-old otherwise healthy man struggle for life on a ventilator due to COVID. We've lost a retired local pharmacist who was a local pharmacist, also a co-caregiver for a special needs individual. And we've witnessed the sad death of a 72-year-old LPN who went back to work in nursing at the nursing home 3 years ago in order to give back to her community. Now, while masks are not perfect, they've been shown scientifically that they help minimize the spread of not only COVID-19 but also the influenza virus. They work to help to tame the Spanish flu in 1918. They helped our school district recently to control their COVID problems, and they helped New York City tame COVID when a stay-at-home mandatory stay-at-home order wasn't actually working to help them. They also helped countries such as Japan, Thailand, South Korea, Iceland, Australia, all to minimize their economic and personal COVID damage. Masks have recently been shown to increase the likelihood that the wearer will have a less serious case of COVID by decreasing the number of inhaled viral particles. I have a list here of 32 references showing that masks help minimize the spread of SARS-CoV-2, available to each of you if you'd like to review them. Now, I've heard rumors that some of our community leaders are basing their opinions about mask wearing on the belief that masks don't help, that the disease is no worse than the flu, that COVID-19 is a hoax, and that masks will make you sick. I've even heard that the vaccine would be the government's way to inject a microchip into your body so you can be followed. These ideas are not obviously supported by the medical or scientific community and are all examples of politically charged internet misinformation and only serve to stand in the way of our community's health and safety. I don't need to remind you that the government leaders have a responsibility to protect the welfare and health of the citizens that we serve. I also shouldn't have to remind you of the old adage that those who fail to learn from history are doomed to repeat it. We lost 670,000 American citizens due to the Spanish flu over 3 years' time, and we're almost halfway there, a little over a fourth of the time with COVID-19. Thoreau once said, the government that is best that governs the least. This is not one of those times. We desperately need our city council to be proactive and enact a mandatory mask ordinance, much like the other 19 Missouri communities have already done, if only for 3 months, to help us get through the flu season and into the time we can all get vaccinated and thereafter return to
Sir, I don't mean to
I'm almost done. So
interrupt you.
yes, sir.
I'll give you about 30 seconds.
I don't even need that. This action may actually help save the economy of our local area and save many lives of our local American citizens and Poplar Bluff citizens. Thank you for your time, and I do have a handout for you guys if you're at all interested.
Okay, thank you. This will not be taken lightly, and we will take this under advisement. And we do appreciate you taking time out of your schedule to be here.